For the last 6 months or so, the world has been dealing with a virus called COVID-19. And as we are all still handling the impact of this epidemic, I thought that today I would explain what this virus is, what steps you can take to avoid it, and in the chance that you do get it, what options you have for treating it. I'm Jared Lautenschlager, and this is the Super Science Show. So what exactly is COVID-19? COVID-19 is the disease in humans caused by the novel coronavirus. Coronaviruses are a large family of viruses that appear mainly in mammals. The novel coronavirus 2019 is the latest strain that has become infectious to humans and was first reported in November of 2019, hence the name COVID-19. The symptoms commonly include coughing, running a fever, shortness of breath and breathing problems, and inflammation of bronchitis tubes in the lungs. In more severe cases, infections can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Older adults and people who have serious chronic medical conditions, such as heart disease, diabetes, and lung disease, appear to be groups that have a higher risk of developing serious COVID-19 related illnesses. For the full list of symptoms, you can visit the World Health Organization's website, which will be linked in the description below. And that list is updated regularly as we learn more about the virus. COVID-19, like most every virus, is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air and quickly fall on floors and other surfaces. You can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19, or by touching a contaminated surface and then your eyes, nose, or mouth. There are various strains of the coronavirus, but some of the more serious ones that have infected other regions include the severe acute respiratory syndrome, also known as SARS-CoV. The SARS-CoV outbreak occurred in the year 2003, primarily in Asia. This was a minor outbreak and has infected about 8,000 people worldwide. In this infection, the total death was nearly 800, which is a 10% mortality rate. There is also the Middle East Respiratory Syndrome, otherwise known as MERS-CoV. The first officially registered case of this virus occurred in September 2012. It was initially named as Novel Coronavirus 2012, but the World Health Organization later changed its name to MERS-CoV. MERS-CoV was also a minor outbreak, and up to 2019, there were only 2,468 registered cases. However, its mortality rate was very high and has reached 34%. That means out of every 100 infected people, 34 of them were dying due to this infection. And of course, we have coronavirus disease 2019, which goes by several names, including 2019 nCoV and SARS-CoV-2. The first reported case of COVID-19, as I mentioned earlier, was in November of 2019. To date, as of the recording of this video, the total number of reported cases of COVID-19 are approximately 4,381,956, with 1,625,097 recovered and a further 294,772 deaths. Now, all of this is not meant to scare you. In fact, having this information will better prepare you during this pandemic. And there are ways that you can go about protecting yourself from contracting this virus. First, if you are not an essential worker, you should try to stay home, only going out for food and other supplies when you really need to. Also, if you do go anywhere, be sure to wear a mask. There are specific masks that the World Health Organization lists on their site that offer the best protection. The link, again, is going to be down in the box below. And when you do decide to venture out, it is recommended that you also try to stay at least 1 to 2 meters or 3 to 6 feet away from others, especially if you or they are not wearing a mask or other protective gear. In the event that you have contracted the COVID-19 virus and you are experiencing any symptoms, please contact a medical professional immediately. The World Health Organization recommends you seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. And while there is no vaccine yet, you do have options available to you so that you can treat your symptoms. People with mild symptoms who are otherwise healthy should manage their symptoms at home. They say that on average it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up as many as 14 days. Managing your symptoms at home includes washing your hands frequently before touching your face, mouth, or eyes, getting plenty of rest, drinking lots of fluids, and eating nutritious foods. It's also recommended that you stay in a separate room from other family members and use a dedicated bathroom if possible. Also, be sure to clean and disinfect frequently touched surfaces. This not only helps to ease your symptoms, but will also help to stop the spread of the virus. I do also want to stress that although there are a few similarities with COVID-19 and influenza, also known as the flu, there are some pretty big differences. And this knocks against a common misconception that COVID-19 is the flu. So this right here comes from the World Health Organization website that's linked down below. It reads, firstly, COVID-19 and influenza viruses have a very similar disease presentation. That is, they both cause respiratory disease, which presents as a wide range of illness from asymptomatic or mild through to severe disease and death. Secondly, both viruses are transmitted by contact, droplets, and fomites. As a result, the same public health measures, such as hand hygiene and good respiratory etiquette, coughing into your elbow or into a tissue and immediately disposing of the tissue, are important actions all can take to prevent infection. The speed of transmission is an important point of difference between the two viruses. Influenza has a shorter median incubation period, which is the time from infection to appearance of symptoms, and a shorter serial interval, which is the time between successive cases, than COVID-19 virus. The serial interval for COVID-19 virus is estimated to be 5 to 6 days, while for influenza virus, the serial interval is 3 days. This means that influenza can spread much faster than COVID-19. Further, transmission in the first 3 to 5 days of illness, or potentially pre-symptomatic transmission to transmission of the virus before the appearance of symptoms, is a major driver of transmission for influenza. In contrast, while we are learning that there are people who can shed COVID-19 virus 24 to 48 hours prior to symptom onset, at present this does not appear to be a major driver of transmission. The reproductive number, which is the number of secondary infections generated from one infected individual, is understood to be between 2 and 2.5 for COVID-19 virus, higher than for influenza. However, estimates for both COVID-19 and influenza viruses are very context and time specific, making direct comparisons more difficult. Children are important drivers of influenza virus transmission in the community. For COVID-19 virus, initial data indicates that children are less affected than adults and that clinical attack rates in the 0 to 19 age group are low. Further preliminary data from household transmission studies in China suggests that children are infected from adults rather than vice versa. While the range of symptoms for the two viruses is similar, the fraction with severe disease appears to be different. For COVID-19, data to date suggests that 80% of infections are mild or asymptomatic, 15% are severe infection requiring oxygen, and 5% are critical infections requiring ventilation. These fractions of severe and critical infection would be higher than what is observed for influenza infection. Those most at risk for severe influenza infection are children, pregnant women, elderly, those with underlying chronic medical conditions, and those who are immunosuppressed. For COVID-19, our current understanding is that older age and underlying conditions increase the risk for severe infection. Mortality for COVID-19 appears higher than for influenza, especially seasonal influenza. While the true mortality of COVID-19 will take some time to fully understand, the data we have so far indicate that the crude mortality ratio, which is the number of reported deaths divided by the reported cases, is between 3 and 4%. The infection mortality rate, which is the number of reported deaths divided by the number of infections, will be lower. For seasonal influenza, mortality is usually well below 0.1%. However, mortality is to a large extent determined by access to and quality of health care. I'm going to be doing another video that I hope to have up very soon, in which I will be covering viruses in greater detail to give some more context and to help better understand what viruses are and how they infect us. Lastly, I want to briefly cover the conspiracy that this virus was created in the lab as some kind of a bioweapon or was let loose from a lab or something. Let me just assure you that it was not. I've covered pseudoscience before, and that is precisely what this conspiracy is. There is no evidence that this was created artificially or that it escaped from the lab for that matter. Both SARS and MERS have been found to come from bats, and this virus is no different. This comes from an article on New Scientist. The link, again, is going to be in the description below. Researchers led by Shan-Lu Liu at The Ohio State University say there is no credible evidence of genetic engineering. The virus's genome has been sequenced, and if it had been altered, we would expect to see signs of inserted gene sequences. But we now know the points that differ from bat viruses are scattered in a fairly random way, just as they would be if the new virus had evolved naturally. So the next time that you're talking with someone and they tell you that they believe the virus was created in the lab or was let loose from the lab or whatever, show them the article linked in the video's description. And if they are honest and they really want to know what the truth is, then that should be enough to help clear up any misconceptions they have about the virus being artificially created or otherwise. I am not an expert, but the information I have shared with you here is from credible sources, and I cite all of them so that you can check behind me, which I encourage everyone to do. And please remember, the best thing to do during a pandemic is to read your guidebooks and don't panic. I'm Jared Lautenschlager. Thank you for watching this episode of the Super Science Show. If you enjoyed the video, I ask that you give it a thumbs up. Also, you can subscribe to the channel and click that little bell notification icon to stay up to date on all of my future content. You can also follow me on social media. The links to all of those will be in the description, along with all the relevant information that I've shared with you here today. If you have any questions, you can ask them in the comments, and I will do my best to answer them, or at least point you in the direction of relevant information. That's all for this episode, and I will see you all in the next one.